The US government's surprisingly thorough investigation into our ChimpVax claims not only rewrites AIDS origins, it's a breakthrough in the debate over free speech, content moderation on X, and the WEF's public-private partnerships. So I apologize for saying the government blew off our claims. I had no idea multiple agencies wanted the truth to come out and went to a lot of effort scouring physical archives, summoning scientists, including the former CDC deputy director and the former head of AIDS epidemiology. So I think I can say it's now official. Yes, content moderation has been erasing major historic events in Western countries on an even bigger scale than China. Yes, Africa's AIDS tragedy was caused by misinformation from Dr. Fauci's agency. And yes, tens of millions died due to a lack of the free speech platform authorities are now trying to take away. It relates to this vaccine.
And thus we had the so-called plasma-derived hepatitis B vaccine, a vaccine that was made from, no doubt, the most dangerous starting material that we ever used.
His book clarifies that the starting material was blood, quote, heavily contaminated with HIV, collected from New York heroin users. They were suffering a junkie pneumonia at the time, now recognized as the world's first AIDS outbreak. His book left out that this vaccine's development began by using funds from Dr. Fauci's agency, in collaboration with Tuskegee researchers, to cross-connect arteries of tranquilized chimpanzees and comatose humans. Mixed raw blood flowed between groups of chimps and humans to train the chimpanzees' immune systems on human hepatitis virus. The vaccine inventors warned it might work the other way as well. Indeed, several of the chimpanzees later tested positive for the closest ancestors to both HIV and Kaposi's sarcoma herpes virus, the deadly combination that sparked the AIDS pandemic. This serial passaging of viruses between species is now called gain of function.
That I would argue created the safest vaccine we've ever used.
You have the responsibility that you might do harm. This is not something for the faint-hearted.
The cause of AIDS wasn't known at the time, but the fear was that perhaps there might be contamination of the vaccine with whatever caused AIDS.
HIV was sort of hanging over this vaccine like a cloud, even though he had proven clearly that HIV couldn't possibly survive the treatments that he had subjected that vaccine to.
I separated into part 2 a deep dive into science to focus on this abbreviated vaccine timeline to quickly get to the ramifications of these new findings.
The AIDS timeline.
We'll quickly review the well-documented and never-disputed events through May 1983 to set the stage for our two fiercely contested events, now resolved by the federal investigation.
1950s.
The world's earliest confirmed HIV-positive being is a chimpanzee used to develop hepatitis B vaccines.
1960s.
Chimpanzees and New York heroin users are cross-transfused with each other's raw blood to generate chimpanzee antigens to fight human hepatitis.
1972.
Scientists at Dr. Fauci's agency announce chimpanzee antigens protect humans from hepatitis B. The first patent is filed for a human vaccine made from chimpanzee antigens.
1973.
The world's first recognized AIDS outbreak occurs among New York heroin users, the first group injected with chimpanzee plasma.
1974.
13,000. New York gay men are being recruited to test the vaccines.
1975.
NYBC and Merck file 3 patents, citing 5 vaccine examples, all made from pure chimpanzee antigens. They patent a circular extraction method similar to dialysis to extract large amounts of antigens from chimpanzees for affordable mass vaccine production.
1978.
After years of testing on volunteers, nationwide placebo-controlled trials begin on gay men, with NYBC's New York trial and the CDC trials mainly in California. The first HIV-positive blood samples are found in gay men. All were collected from the cohort. All were the never-before-seen subtype B that sparked the global AIDS pandemic.
1979.
In September, 10 months into the trial, the scientist in charge wants to abort when an unexplainable, quote, flare-up appears in precisely 11 participants who received the vaccine. He is warned aborting would irreparably harm the vaccine's reputation. Soon the CDC will report unexplainable cases of Kaposi's sarcoma in gay men, noting that precisely 11 had experienced the initial flare-up as of September 1979. By December, there are 19 cases and the first death. This is now recognized as the onset of the world's second AIDS outbreak, affecting the second group inoculated with chimpanzee-plasma-derived vaccines.
1981.
A cancer researcher suggests that a new infectious agent, with a 50% mortality rate, may be causing the Kaposi's sarcoma cases at vaccine trial sites. He soon claims it was transmitted in the vaccine, as rapid disease progression occurred exclusively in vaccine trial participants. Trial scientists confirm his key claim, reporting the incubation periods are, quote, quite different and longer in gay men who had not participated in the vaccine trial. In the next 15 months, another 593 cases will emerge, and 41% died. The same month, Merck announces Heptavax B, a third US brand, this one for the domestic market. The original Merck HB-Vax and NYBC B-Vax will be offered only in overseas markets. Following compromises to get FDA approval, this new version is made exclusively from human blood. However, without the patented circular chimpanzee extraction method, it is, quote, too expensive for large-scale use anywhere.
1982.
The CDC names this disease AIDS in a bulletin, assuring the public the new FDA-approved vaccine uses only human blood, distancing it from earlier vaccines. The WHO, in the last public mention of chimpanzee-based vaccines, warns AIDS may be caused by a virus in the vaccine's plasma.
May 1983.
French scientists identify the causal virus, enabling testing of archived blood samples from trial participants. In the end, it was a chimpanzee virus, and the Kaposi's sarcoma lesions in early AIDS cases required simultaneous co-infection with a second virus, also found in those chimpanzees. This discovery enables verifying what was, at the time, the sole and most obvious AIDS origin theory, namely verifying vaccine transmission by comparing HIV rates between men randomly given the hepatitis B vaccine versus a placebo during the clinical trials.
The next two events were the pivotal, fiercely contested claims in our ChimpVax preprint, which have now been settled.
June 1983.
The two scientists at Dr. Fauci's agency who developed the chimpanzee-based vaccine assured world leaders it was a false alarm, claiming infection rates in the New York trial were similar between those who received the vaccine and the placebo, allegedly in a personal communication from NYBC trial scientist Dr. Stevens. Part 2 covers our numerous exchanges with NYBC scientists of that era following our outreach to Dr. Stevens. The fact is, Dr. Fauci's scientists were spreading the most dangerous disinformation to defend their chimpanzee vaccine invention. All participants with AIDS had received the vaccine. Dr. Stevens later reported that nearly half the participants contracted HIV during the trial, but no one ever claimed similar rates among placebo recipients.
1984.
The CDC claims rates did not differ in, quote, men who did or did not receive hepatitis B vaccine in the vaccine trials conducted by CDC in Denver, Colorado and San Francisco, California. The CDC never released that internal private study. It sounds like they're saying they found rates did not differ in vaccine versus placebo. But the wording is ambiguous. Technically, the hundreds vaccinated before the trial also did not receive vaccine in the trial. So, technically, the CDC could have merely found rates were comparable in those vaccinated before and during the trial. Did the CDC find similar rates but use imprecise wording? Or did the ambiguous wording conceal a significant difference? The investigators went to incredible lengths to retrieve that withheld private study, including summoning data experts and scouring the mountain of physical archives. Nothing. It was wiped. Everyone who would have seen it claims ignorance. But our research concluded that it must have found that all, or almost all, of the 600 participants who contracted HIV during the trial had received the vaccine. We based this on the one and only public study the CDC commissioned to compare HIV rates in vaccine versus placebo years later, when a book blamed AIDS on the vaccine. We argued the CDC designed the sole study which the public would see in a way that, even if the vaccine transmitted HIV, it would appear to have prevented HIV. The reason is the CDC compared HIV rates in trial participants 6 years after the trial ended, when HIV's sexual spread was at its peak, diluting HIV contraction during the trial. However, the study only included participants who contracted hepatitis B during that time. Since hepatitis B is up to 100 times more transmissible than HIV, unvaccinated gay men almost always contracted it before HIV and would be counted, even though they most likely contracted HIV after the trial. In contrast, vaccinated participants would only be counted if they had a rare breakthrough hepatitis B infection. In other words, the results should have shown much higher HIV rates in the unvaccinated, creating the false impression that the vaccine offered protection against HIV. However, it didn't work because gay men in the trial only contracted HIV during the trial. After the trial, as HIV was spreading like wildfire in the gay community, there was almost no spread among trial participants because they were the lowest risk gay men who had no prior hepatitis exposure. Their HIV rates went from 0% to 42% during the trial, and then remained steady. Therefore, 6 years after the trial, of the 1,402 trial participants, nearly all of whom were tested for HIV, only 14 unvaccinated men had contracted HIV, a mere 1%. Since they likely contracted HIV as sexual transmission increased post-trial, that means when the CDC made the ambiguous statement implying similar rates, only a few, if any, unvaccinated placebo recipients were likely infected. That was the basis for our claim that the CDC's withheld private study must have shown that nearly all of the approximately 600 participants who contracted HIV during the trial had received the vaccine. The investigators sent our chart to many scientists, including Dr. Hadler himself, along with our claim that, despite effectively counting all HIV in the placebo group versus a portion of HIV in the vaccine group, HIV rates were still precisely dose-dependent. Only 9% in the placebo group, climbing to 42% in the men who received all 3 doses. Nobody disputed the numbers. Nobody challenged our interpretation. Notably, nobody is claiming any of the CDC's private studies ever found HIV rates to be similar in vaccine and placebo. Despite the obvious significance, Dr. Hadler conceded there was no investigation, and he never compared HIV rates except in this subset heavily skewed to exonerate the vaccine. He referred to San Francisco scientists who still have the full data. As shown in Part 2, those scientists had been deceived by Merck's manipulative language that led them to believe gay men in the trial had received the same human blood Heptavax as everyone else, not the overseas chimpanzee blood HB-Vax. Unable to explain why only gay men became infected post-vaccination, the trial scientists explained the extreme rationalizations they resorted to, assuming either the vaccine was so effective that only the vaccinated were sexually active, while placebo recipients were ill with hepatitis, or possibly the vaccine temporarily lowered immune response. However, even if they didn't understand the vaccine's causal role, it was undisputed, and had there been a transparent public discourse, the truth would have come out before the chimpanzee-based vaccines were given to millions of people in poor countries. The former head of AIDS epidemiology also wrote, quote, "Regarding issues such as testing the vaccine for HIV, I'm almost certain that was done, and I expect that Merck would have records most relevant to that issue. Yet since the 1980s, Merck has deflected demands for the test results by claiming it was the CDC that tested the vaccine. But the CDC study they cite merely confirmed HIV was inactivated in the new FDA-approved human blood version.
Now consider the next two events from our timeline, and remember that before Africa's vaccine rollout began, only a few HIV cases existed in Africa, confined to a single region.
1984.
The vaccine's maker returned to the WHO at a symposium on Africa, armed with the misinformation about similar rates in vaccine and placebo, and a bulletin from a senior FDA official and former FDA official at Merck. It claimed AIDS was, quote, never documented to be transmitted by blood, and was likely caused by gay party drugs like poppers, making it, quote, inevitable that cases of AIDS will occur in vaccine recipients unrelated to the vaccine itself. Later court filings reveal that 1 year before this FDA bulletin, the agency informed pharma executives that their blood-derived products appeared to transmit the virus, but agreed to, quote, keep out of the public eye their continued overseas sales to avoid write-off costs. Part 2 documents that as AIDS began to emerge in Africa 1 year after this symposium, the same FDA officials replaced references to the old chimpanzee-based vaccines with the new FDA-approved human blood HeptaVax, misleading a team of scientists who now hail ChimpVax as the explanation for observed phenomena. Thanks to this FDA pharma public-private partnership, the manufacturer was able to assert to the WHO that the old vaccine's prohibition in Europe and the US was overly cautious and promoted it as a cost-effective option for mass vaccination in Africa. He presented the same 2 lots shown to the WHO in 1977, along with a microscopic image he originally identified as residual viral material from chimpanzee plasma. But he has now adopted Merck's species-ambiguous language for those original vaccines, calling it carrier plasma.
1986.
Chimpanzee-based vaccines are now, quote, widely used in poor countries, primarily for pregnant women and newborns. The WHO and CDC report that HIV only recently began spreading beyond its original Congo epicenter, because initial infections were concentrated in newborns under 12 months old and women aged 16 to 29. Half of HIV-positive infants had uninfected mothers, but only in hospital settings, and half of HIV-positive mothers had uninfected husbands. Many studies concurred that HIV's emergence in Africa was through recent medical injections, namely vaccinations. This led to an internal WHO report concluding 10 million people were being infected with deadly diseases every year through medical injections, causing a baby to die every 20 seconds. However, as the WHO's original vaccine transmission theory was believed ruled out, they assumed HIV spread through dirty needle reuse, expecting single-use needles would quietly resolve the issue without alarming the public. Thus, the WHO suppressed their own findings to, quote, not jeopardize their immunization program. We can see how well that worked since extensive blood samples had been archived across sub-Saharan Africa to track hepatitis rates pre-vaccine. Retroactive testing showed all African countries, except these, were HIV-free when the vaccine arrived. In the Congo, Africa's original epicenter, less than 1% had been infected after a century of alleged HIV spread. Here are the rates when chimpanzee-based vaccination ended 15 years later, with up to 32% infected in those southern countries that began completely HIV-free.
Some time ago, I started a group email with those scientists who sacrificed lucrative careers, some at the WHO and CDC, to raise the alarm about HIV spread in Africa from medical injections. And they were my productive critics, pointing out flaws, forcing me to rethink, do more research, constantly poking holes in my arguments, as you can see. And after many rounds of fixes, one called ChimpVax the, quote, best account of probable HIV origins. So with that level of expert validation, I figured there'd be no problem getting ChimpVax out. I mean, at least as an unreviewed preprint. Nope. Mainstream preprint servers still rejected it. Those scientists just welcomed me to the club. Part 2 covers how for 40 years their obstacle was censorship, as Dr. Fauci's Proximal Origins authors quashed their research despite internal reports within the WHO, CDC, and Dr. Fauci's own agency confirming their claims. So if we had access to an uncensored platform in the 80s, this would have come out long ago. But everything I post is censored everywhere but X post-Elon. So if we let authorities similarly rein X in, this whole topic will again vanish from memory, just like Tiananmen Square in China. Part 2 deep dives into all the evidence and the investigation and findings and responses from the trial scientists in San Francisco and New York. Now they know what happened and they're all retired now. And I'm cautiously optimistic that with the right support, one might come out of the lab closet and go public. So please ask influential people with the resources to provide them a safe platform. This is so much bigger than AIDS. Please indulge me while I climb on my soapbox to explain how this can derail the train to dystopia that departed 50 years ago.
At the World Economic Forum, we have been advocating for public-private collaboration for more than 50 years. So we are today a trusted partner of governments and business and international organizations and so on.
Now, hold that thought.
I would like Democrats and Republicans to both reject censorship.
You can't yell fire in a crowded theater.
Okay, that's wrong, but regardless, we've always had laws holding people accountable for falsely crying fire. The question is, should we allow a public-private partnership where a corporation profits from burning down their theaters to collect insurance and shares the proceeds with public officials who censor theatergoers trying to cry fire and save lives? I mean, doesn't that describe AIDS? There was a fire. Africa was burning, but the scientists trying to cry fire were censored by a public-private partnership between big pharma and government regulators that put them on the same side of the table with we the people on the other. Regulating free speech is always a slippery slope, but it's nuts that we put that immense power in the hands of captured regulators who've become commissioned salesmen peddling products from the companies they regulate. In one of my first videos, I shared how my late business partner expressed deep regret over his involvement as an early executor of the WEF's agenda. So he was vilified for orchestrating the public-private partnership between the military and war contractors that resulted in his scripting this fake testimony to start the Gulf War. However, his deepest regret came during what the New York Times called the height of his influence, after orchestrating the campaign to get his friend Ronald Reagan elected. It was then that he helped forge the most unholy alliance between public health officials, whose duty was to prevent disease, and private companies that profit from it. He took his early tobacco as medicine campaign, to the next level with opioids as medicine, bringing health agencies into the fold to share the profits. At the same time, they lobbied Congress to grant vaccine manufacturers total immunity, using this report authored by, the chimpanzee vaccine producer, just months after discrepancies between the vaccine and placebo emerged. Merck's CEO testified before Congress claiming that without vaccine immunity, the pharmaceutical industry would face bankruptcy. Now, there was no conspiracy, just the alignment of interests through public-private partnerships. So I'm hopeful that the truth about the origin of AIDS helps show that we must start disaligning these interests, ensuring regulators sit on our side of the table, not the companies they're meant to rein in. Consider the conflict of interests. Today, the EU Commission president is demanding full transparency from her citizens while being sued by them for withholding her private text messages with Pfizer's CEO negotiating a vaccine deal her citizens were forced to pay for, while she demands the power to penalize Elon Musk if he doesn't let her censor the scandal on X.
Your leadership is a beacon of inspiration.
Excellencies, ladies and gentlemen, dear Klaus, your annual global risk report makes for a stunning and sobering read, the #1 concern of the Global Risk Report: disinformation and misinformation. It is disinformation and misinformation, industrial scale disinformation. For example, with disinformation and misinformation. With our Digital Services Act, we defined the responsibilities of large internet platforms on the content they promote and propagate.
And they're putting out disinformation. Our First Amendment stands as a major block to the ability to be able to just, hammer it out of existence. So,
yeah, come on. They were already able to hammer out of existence any mention of chimpanzee-based vaccines without these new laws. So before they rein in X and this whole ChimpVax topic becomes censored again, let's show everyone what happens without free speech. So as I respectfully ask experts to fact check, please amplify, asking them to publicly confirm or show hard evidence to refute our claims. Let's ensure everybody sees if there's consensus that this truly happened and was swept under the rug. If you like this approach to research, please consider supporting Fact Mission.